Finding Hemo by Melanie Dat, Cameron Overall, Natasha Tujudin, and Alejandro Rigg. Hemophilia is a genetic disorder that impairs the body's ability to control blood clotting. Blood clotting creates scabs that stop the bleeding when a blood vessel is broken. Hemophilia lowers the blood plasma clotting factors needed for the normal clotting process. A temporary scab does form, but the missing factors prevent a permanent scab from developing. Hemophiliacs do not bleed more heavily than a normal person, but they bleed for a longer time. Hemophilia A is the most common form of hemophilia. People with hemophilia A are missing or have low levels of the clotting factor 8. 9 out of 10 people with hemophilia have type A, representing 80% of hemophilia cases. Most people with hemophilia A have severe hemophilia symptoms. It occurs most often in males because it is a sex-linked recessive disorder. Most people with hemophilia A have a family history and are born with the condition. However, in 30% of the cases, there is no family history and it happens as a result of a gene mutation. Since hemophilia is a sex-linked, there is an abnormal gene on the X chromosomes. Mostly males have the disorder, but it is very rare for females to have hemophilia. They mostly carry the disorder. To get the disease, females need 2 defective X chromosomes, but males only need 1. The only way a female can inherit hemophilia is if their mom is a carrier and their dad is a hemophiliac, and there's still only a 25% chance. This makes hemophilia in females very rare. Also, there is no karyotype for hemophilia because it's not caused by extra or missing chromosomes. With hemophilia, there is an error in one or more base pairs in the DNA. There are many symptoms in hemophilia, and they depend on severity. Some signs of hemophilia are excessive bleeding and easy bruising. Hemophiliacs can also bleed internally or externally. Some signs of external bleeding are bleeding in the mouth from a cut or a bite, unexplained nosebleeds, heavy bleeding for a minor cut, bleeding from a cut that resumes after creating a scab. And some signs of internal bleeding are blood in urine, blood in stool, and large bruises. A hemophiliac can also bleed in their joints near their knees or elbows, or they can also bleed in their brain. Treatments. The most common form of treatment for hemophilia is called replacement therapy. Concentrates of clotting factor 8 are slowly dripped or injected into a vein to replace the missing clotting factor. Unfortunately, replacement therapy has complications. Your body may develop antibodies that attack the clotting factor. Hemophiliacs can also develop viral infections which have no cure. The clotting factor can also cause damage to your joints, muscles, and other body parts. Another form of treatment for hemophilia A is desmopressin. It is a man-made hormone and stimulates the release of stored factor 8. Everyday life of a hemophiliac. Hemophiliacs have to visit the doctor often because they must get transfusions of the clotting factor in order to make the blood clots. People with the disorder must also protect themselves from minor injuries. And the typical lifespan for hemophiliacs is 10 years less than people without hemophilia. Social and ethical concerns. Hemophiliacs try to help people understand that they will not die from one small cut. They may not be able to play sports they are interested in or other physical activities in which they might get hurt. Funding for research or cure. As of now, there is no cure for hemophilia. Although, as I spoke about earlier, they can get treatments for the missing clot factors, and this could be also considered as a cure. Now that you know more about hemophilia, please donate your money to our fund to find a cure for hemophilia.